We're going to be going over hair removal this morning, and the first thing we need to talk about is why are we removing hair? Because usually we're in the hair business of fixing hair and curling hair and straightening hair. But women have a lot of undesirable hair, and they have hair in areas they don't want hair. So thus, it's hair removal. The book gave us a little bit of history about it and how women have been fighting this problem for a long, long time. Hirschutses or hypertrichoses are terms that refer to the growth of an unusual amount of hair on parts of the body that normally bear only downy hair, such as the face of women, and some men want that off the backs of their hair, or off of the hair off their backs. It may also be referred to, and I see they're doing away with it a lot in the book, as superfluous hair. Superfluous, or hirschutses, or hypertrichoses. This unwanted hair has been treated throughout the ages with a lot of things. As they evacuate the early Egyptian tombs, they see where they've used abrasive materials such as pumice stone to rub away the hair. You know, we take the pumice stone now and get the rough skin off of heels and feet and all that. Can you imagine taking that to rub your little mustache off or your beard off? It seems to me there's got to be a lot of skin going down with the hair. Ancient Greek and Roman women were known to remove most of their hair by similar methods, and the Native Americans caught on and sharpened stones and seashells to rub, or actually to kind of shave it off, like we use razors for now. History also records chemical means of removing this excess hair. The ancient Turks used rusma, which is a combination of yellow sulfide of arsenic. Does that word ring a bell? Quicklime and rose water as a crude hair removal agent. Facial and body hair removal has been increasingly popular as evolving technology makes it easier. Women comprise the vast majority of hair removal clients, most often wanting to get rid of their body hair on the upper lip, cheeks, chin, neck, underarms, navel, bikini line, buttocks, and legs. Hair removal for men is also on the rise. Men may choose to have unsightly hair removed from their backs, their shoulders, and their chest, especially if they compete in certain sports like bicycling and swimming. They may want the hair removed from their legs and arm because they go faster. There's no drag from the hair. There are two major types of hair removal in use today, the permanent and the temporary. The first thing we want to do before we do any hair removal services is to hold a client consultation, just like with everything else, except now you got to remember we're going to be using waxes maybe, or chemical depilatories, and we want to find out about these people's medication, their medical history, their allergies, and all this good stuff. One of the main purposes of the client consultation is to determine the presence of any contraindications for hair removal. Leg waxing should not be performed on a client who has varicose veins or phlebitis. Facial waxing or tweezing should not be performed on those clients who have any of these following conditions or have had these treatments. Rosacea or very sensitive skin. Somebody stopped me in the office day before yesterday talking about Miss Garrett's skin from the microdermabrasion, and this other instructor come in about that time, and she was talking about she would like to have that done. She said, but I'm almost sure I probably can't because I have rosacea. I assured her she can forget about microdermabrasion. Now we know she can forget about having hair removed in the areas where rosacea may be a problem. We wouldn't want to do hair removal on someone who has a sunburn, who has a history of fever blisters and cold sores. If there's a presence of pustules or papules, we don't want to do hair removal on clients who've had recent chemical peels using glycolic, salicylic, or other acid-based products. On those clients who have had Botox or collagen injections, or those who have had cosmetic or reconstructive surgery, such as a facelift. Clients using some of these medications should not receive hair removal treatments. Retin-A, blood thinning medications, or topical or oral cortisone medications, or Accutane. I would strongly advise you to have a release form signed by your client before you do any hair removal services on them. The first thing we want to talk about is permanent hair removal. And that means that when we remove it, it's gone forever and no more will grow from there. And always, in order to do that, somehow you have got to kill the papillae that's down in the hair bulb. And I had gotten approval a year or two ago to get an electrolysis machine, and I thought that would be nice to train on in school. But the fact of the matter is that hardly anybody goes through electrolysis anymore because it takes a long, long time to achieve permanency, and it's expensive, and it has been overrode now by laser hair removal. So let's talk about our permanent hair removal methods, or permanent hair removal methods that are in place today. We no longer can offer this because we can't offer the laser hair removal, and at least not in our state up until about 3 months ago. You could go to a company and buy a laser hair removal system and just do it at home on people. Open you a little laser removal shop. But they come in now, and you can only have it done through a physician's office. Electrolysis is the removal of hair by means of an electric current that destroys the root of the hair. The current is applied with a very fine needle-shaped electrode that is inserted into each hair follicle. This technique can be painful, time-consuming, and expensive, and must be performed only by a licensed electrologist. Now, and you could become a licensed electrologist in Georgia simply by going to a company that you've already got your master cosmetology license. Go to a company that sells these machines, and they put you through a 3 or 4 day training, and then you go out there and do it. The problem with it is the little wire. I call it a wire, they call it electrode, but it's so small you can't call it a needle because it's even smaller than, you know, your very finest needles. You've got to figure out in which direction that hair follicle grows. You know, is it coming straight out? Y'all know on your mannequins you just stick it straight in, but ours has a slope to it, and that electrode has got to go in the direction of the slope. You can't see when you've reached the papilla to know that you've got that probe on it or electrode on it, and then the electric current has to be turned up enough to destroy that papilla. So that's what so time consuming. So you may treat this hair and it come back because you didn't have the probe or electrode on that. So that's what. The next type of permanent hair removal is photoepilation. The U.S. Food and Drug Administration, or FDA, has recently approved the use of photoepilation for permanent hair removal. Uses intense light to destroy the hair follicles. This treatment has minimal side effects, requires no needle, and thus eliminates any risk of infection. Clinical studies have shown that photoepilation can provide 50% to 60% clearance of hair in 12 weeks. So that's not too bad. You know, take another 12 weeks, get rid of the other 50%. This method can be administered in some salons by cosmetologists and estheticians, depending on state law. Manufacturers of photoepilation equipment generally provide the special training necessary for administering the procedure. But again, that come in and it's kind of got outdated because of the next method of permanent hair removal, which is laser hair removal. Lasers are a new method for the rapid, gentle removal of unwanted hair. In laser hair removal, a laser beam is pulsed on the skin, impairing the hair follicles. It is most effective when used on follicles in the growth phase or the anagen phase. The laser method was discovered by chance when it was noted that birthmarks that had been treated by certain types of lasers become permanently devoid of hair. So no hair came back. The birthmark went away and so did the hair. Lasers are not for everyone. The absolute requirement is that one's hair must be darker than the surrounding skin. So if you've got the little lady that's older and her hair's turned gray, laser's not going to work on her. Coarse, dark hair responds best to laser treatment. For some clients, this method brings truly permanent results. The laser can also slow down regrowth. In certain states and provinces, cosmetologists or estheticians are allowed to perform laser hair removal. This method requires specialized training, most commonly offered by laser equipment manufacturers. So I'm going ahead and answer your questions. Not in Georgia. You can't do it. The temporary methods of hair removal, and that's where we come in a lot. Some of these we're going to offer in the salon, and some of them we aren't. The first temporary method we're going to talk about is shaving. Shaving was very popular back in the old West for the barber shops. You know, these cowboys, they didn't shave. They go in and get a haircut and a bath and a shave. But we don't shave commonly in the beauty salon. But it is the most common form of temporary hair removal, particularly of men's facial hair. Shaving is usually recommended for women when the unwanted hair covers a large area such as the underarms and legs. It's most often done by women at home and represents a quick and convenient solution, although it can sometimes result in skin irritation, ingrown hairs, and nicks from the razor blade. Shaving cream or lotion is applied before shaving. That cream or lotion is applied because to soften the hair a little bit so it'll cut easier, and also to make it glide over the skin smoother. If you have ever tried shaving without using a cream, you've wound up with red bumps, a little bump everywhere there was a hair. It's almost like a heat rash. An electric clipper may also be used, particularly to remove unwanted hair at the nape of the neck. The application of a pre-shaving lotion helps to reduce any irritation. Next is tweezing, and we certainly do employ that in the salon. Tweezing is commonly used to shape the eyebrows and can also be used to remove undesirable hairs from around the mouth and chin. Eyebrow arching is often done as part of a professional makeup service. Correctly shaped eyebrows have a strong positive impact on the overall attractiveness of the face. The natural arch of the eyebrow follows the orbital bone, or the curved line of the eyebrow socket. How many of y'all remembered about the orbital bone? We're back in anatomy now. Most people have hair growth both above and below the natural line. These hairs should be removed to give a clean and attractive appearance. When I trained, the set law, and it was chiseled in stone, was never pull above the brow. Do whatever shaping you've got to do below the brow, and never pull a hair above it. And I am so glad they got away from it, because I never followed it. You know, if one's up there, if 14's up there, and they're wild and they're causing the eyebrow to be out of shape, take them out. Electronic tweezers. About 11 or 12 years ago, I thought I had a chance to buy some electronic tweezers here. There was a company that come out and said simply by putting the tweezer on there, letting an electrical current go through the hair, it would permanently remove it. I was going to teach these students how to do it real easy. One of my students that works in a shop in Rennes, as a matter of fact, she owns her own shop in Rennes now. She come by, she hadn't been long, got her license and went to work up there. And she come in and introduced me to this wonderful tool. Brought the business card of the company and all. She said, "You're just going to love it." They had just started doing clients with it. And I'm going through all the red tape that you go through with the state fixing to get us some of them. You know, all these people, we were doing waxes and all along, we was fixing to give them a permanent solution to that problem. And just about the time I got all the paperwork ready and had it approved, she come flying down here one night and said, "Don't order them electronic tweezers. The company's having to come by and pick everybody's up and give them their money back because it's not permanent." And they had sold it under that premise. So the book is kind of contradictory. If you read that, you notice they said two things about electronic tweezers. One, that eventually it may cause it to be destroyed, and two, it's not a permanent method. Well, if eventually it causes that hair to be destroyed, then it's going to be permanent. Another method for the removal of superfluous hair used in salons and spas is the electronically charged tweezers. This method transmits radio frequency energy down the hair shaft into the follicle area. The papilla is thus dehydrated and eventually destroyed. The tweezers are used to grasp a single strand of hair. The energy is then applied first at a low level to pre-warm and then at a higher level for up to 2 minutes to remove the hair. Most manufacturers suggest that the area be steamed first in order to increase efficiency. Electronic tweezers are not a method of permanent hair removal. Furthermore, the process of clearing any area of hair by this method is slow. You got to keep the tweezer on one hair for about 2 minutes. Can you imagine doing somebody that's got a whole big mustache and a bunch under here? She might as well spend the day with you. The next temporary method of hair removal we have is a depilatory. Depilatories are substances, usually a caustic alkali preparation used for temporary removal of superfluous hair by dissolving it at the skin level. Y'all all know about it. They show it on TV, Neat and Nair and all that to put on your legs. And the book's going to go on and tell you this, but I always like to discuss it at this point. Most of these alkali preparations are made out of sodium hydroxide. Where do you remember sodium hydroxide from? Chemical hair relaxers. That's exactly right. Isn't it a little scary that the chemical that we use to take curl out of hair is also used to dissolve hair? That's why we're so cautious as we go through chemical hair relaxing. Of course, this is a lot stronger chemical that we're going to use to dissolve the hair, but it's the same chemical, just more concentrated. But it does let us know that if we choose the wrong type of chemical relaxer or we leave that chemical on there too long, what's going to be the outcome? We're going to dissolve it. It contains detergents to strip the sebum from the hair and also adhesives to hold the chemicals to the hair shaft for the 5 to 10 minutes that are necessary to remove the hair. During the application time, the hair expands, the disulfide bonds break. Finally, such chemicals as sodium hydroxide, potassium hydroxide, thioglycolic acid, or calcium thioglycolate destroy the disulfide bonds. These chemicals turn the hair into a soft jelly-like mass that can be scraped from the skin. Although depilatories are not commonly used in salons, you should be familiar with them in the event that your clients have used them. There is some facial depilatories that you can use, and they have like a pre-cream that you put on, because it will also, if it's doing all this to the hair, what do you think it's doing to the skin underneath? So you got to be real careful with these clients and not let it chemical burn the skin. If a client requests a chemical depilatory, you should perform a patch test to determine whether the individual is sensitive to the action of the depilatory. Select a hairless part of the arm, apply a small amount according to the manufacturer's directions, and leave it on the skin for 7 to 10 minutes. If there are no signs of redness, swelling, rash, the depilatory can probably be used with safety over a larger area. But make sure you follow the manufacturer's directions to a T. As a matter of fact, if they've put that pre-cream in there, you want to read about it and see, what to do. Epilator. An epilator removes the hair by pulling it out of the follicle. Did y'all see on TV, and y'all would have been children when this come out, but Epilator, they got real popular there several years at Christmas. And it had springs that turn round and round. And you rub it up your leg and it catches the hair in it and pulls it out. Now, I thought I had to have me one of those. But I got saved. My sister-in-law got one instead, and she called me one night about crying at the top of her lungs and screaming. She said that was the most painful mess. She said it's just snatching out a handful of them at the time out of your legs. And I'm like, shaving doesn't seem all that bad anymore, does it? Wax is also a commonly used epilator, applied in either hot or cold form as recommended by the manufacturer. Both products are made primarily of resins and beeswax. Cold wax is somewhat thicker and does not require fabric strips for removal. Because waxing removes the hair from the follicle, the hair takes longer to grow back. The time between waxings is generally 4 to 6 weeks. Let me tell you about the cold wax too. They have it advertised for people to buy just off the street. Now notice they've changed their commercial. There for a while, the cold wax, you take it and get it at body temperature, by putting it in your hands and squeezing it and all that, and put it on the legs, whatever, and then you pull it off and the hair comes off with it. They said use it over. You can use it over and over and over. What's my problem with that? It's got hair all over it. Well, it's your hair. But do we really want all that You know, that stuff was living one time, and part of it might have been living when we put it and rolled it up in that ball to save it for a week later. I didn't like that. Wax may be applied to various parts of the face and body, such as the eyebrows, the cheeks, the chin, the upper lip, the arms, and the legs. On male clients, wax may be used to remove hair on the back and nape of the neck. Oh, goodness, I can't imagine. That's got to be painful. The hair should be at least 1/4 to 1/2 inch long for waxing to be effective. Do not remove vellus or lanuga hair. Doing so may cause the skin to lose its softness. And that's the little hairs we all have here. It's real soft. If you rough them up, you can, you know, rough somebody else's up. Stick them, yeah, they do kind of tickle. You don't want to remove that. Before beginning a wax treatment, be sure to complete a client consultation card and have that client sign a release form. Wear disposable gloves to prevent contact with any possible blood-borne pathogens. When we use that wax, some people have little blood droplets that come to the surface as that hair is pulled from its follicle. So the last thing you want to do is be touching. And let me tell you, I'll tell y'all this when we do an eyebrow arch demonstration, but I want to tell you this ahead of time. And I don't know why this works, so don't ask me. But when you snatch that strip off, if you will tell them to put their finger there and press, the pain will go away just that quickly. That's all you got to do is press on it. We used to do that as a service to our clients. And if we had on gloves, we still could. But we don't want to take the chance of putting our hand down there where we've just opened up those follicles and pulled something out of it.
So as long as we have on gloves, we can still...
You can still do it. And I promise you it'll take the pain away just like that. I don't know what it is. I guess something like acupuncture or something. But it'll stop right then when you touch it. To me personally, it hurts to be waxed, but it doesn't hurt half as bad as tweezing. Every time they pull a hair, I have pain. So I'd rather just snatch them out and have and mash on it, and pain's over. Our caution is that beeswax has a relatively high incidence of allergic reactions. Always give a small patch test of the product to be used prior to the service. Our safety precaution, and that's the common things we do in the salon, and that's the common temporary and permanent hair removal systems. To prevent burns, always test the temperature of the heated wax before applying to the client's skin. Everybody says, where do you test it? You test it right there on yourself. Use caution so that the wax does not come in contact with the eyes. You don't want to get it in their eyes. Do not apply wax over warts, moles, abrasions, or irritated or inflamed skin. Do not remove hair protruding from a mole, as the wax could cause trauma to the mole. The skin under the, well, we don't remove it with tweezing either. The skin under the arm is sometimes very sensitive. And I don't think I want to be waxing, but it says if you're going to wax, use cold wax. Redness and swelling sometimes occur on sensitive skin. Apply an aloe gel to calm and soothe the skin. Threading is a temporary hair removal method that is still practiced in many Eastern cultures today. It involves the manipulation of a cotton thread which is twisted and rolled along the surface of the skin, thus entwining the hair in the thread and lifting it from the cuticle. It's like the Epilation I was telling y'all about a while ago. Threading has become increasingly popular in the United States as an option to other methods. It requires specialized training. Then we have sugaring. Sugaring is another epilator treatment. It is also becoming more popular and produces the same results as hot or cold wax. It involves the use of a thick sugar-based paste and is especially appropriate for more sensitive skin types. Removing the residue from the skin is simple as it dissolves with warm water. We want to go over our little chart here of what type of hair removal system for what area of the body. The face, the upper lips, and the eyebrows, we use waxing or tweezing. The underarms, we use waxing. The arms, we use waxing or depilatories. Y'all remember what depilatories are? That's neat and near our chemical dissolvers. The bikini line, we don't do. But for those of you who want to carry something for them to buy and do at home, the bikini line can be waxed. It can be tweezed. The legs can be waxed or use a depilatory. The top of the feet and the toes, you may wax or use a depilatory. Have any questions?